But I wasn't given a choice. I had to have a mastectomy. So that was organised, and I went in on the 18th of January, and I had my mastectomy, and again the care was amazing. You could not fault anybody at all. Very well looked after. And then basically they let me out. The following day I went home. And then after that I had quite a lot of seroma keep coming in to the wound. Well, they send you home with a drain first of all, and then that's obviously taken out after a few days with a nice little handbag to carry it around in. And when the drains was taken out, I started to get seroma, which is quite painful because it all sort of swells up, and it makes all your skin really tight. But there's a fantastic seroma clinic at Glenfield where you can go along and have it drained away on a regular basis if you need it. And then I was referred on to the oncologist who decided that I should go for chemotherapy and radiotherapy.
Right.
Because I'd had some lymph nodes involved. They took 3 lymph nodes and 2 out of 3 were infected with the cancer cells. But instead of actually having a clearance of lymph nodes, I went for radiotherapy to my armpit because I didn't particularly want any more surgery. But they said you either have one or the other, and it works exactly the same. So that's what I went for, because it was sort of less invasive, after already having had a mastectomy.
Were there any other options given you? I'm thinking maybe reconstruction on that side.
I was offered reconstruction, but it's my personal preference not to have it, purely because I want to know exactly what's going on behind the reconstruction or behind the skin.
Yes.
And I'm always a bit scared that you don't know what's going on behind it. And the other thing is, providing, your husband and everybody concerned is quite happy with the way that you are.
Yes.
The prosthesis that they give you is very, very good, really. As long as you get the right underwear with them and everything. For me, personally, it's not for everybody. But I find that adequate, and it doesn't affect my life, with my husband or anything else. So that's. Also, I know a lot of people that have had reconstructions that have said that if they'd have known what it would have been like, they wouldn't have had it done. But everybody's different, and I think that's a personal thing that you have to decide for yourself. I think a lot of it is how you feel,
Yeah.
But you don't have to decide there and then. You can go back years down the line and ask for it if you're not happy.
Exactly.